Hi, and welcome back to my channel, the Tooth Talk Studio. I'm Dr. Veena, General Dental Surgeon at ASHIRVAD Dental Clinic, KUDUR, Bangalore South District. Today, I'll be talking about pediatric dentistry, that is pedodontics. If you are a parent, you already know that getting your child to brush their teeth can sometimes feel like preparing for a battle. But did you know that cavities are actually the most common childhood disease? Today, we are going to deep dive into everything you need to know about pediatric dentistry. We are covering baby teeth milestones, how to stop toothbrushing tantrums, what actually happens during their first dental visit, and how to protect their smiles for life. By the end of this video, you will have a complete roadmap to your child's oral health. First, baby teeth matter. Let's start with a myth that I hear almost every day in my clinic. They are just baby teeth. They are going to fall off anyway. So, why I need to protect these? I completely understand why it seems that way, but baby teeth are actually crucial for three major reasons. Reason number one, they act as placeholders. Baby teeth hold the exact space needed for permanent teeth. If a baby tooth is lost too early due to decay, the surrounding teeth might shift, causing massive crowding issues later on in future. Reason number two, nutrition and speech. Kids need healthy teeth to chew nutrition dense foods and learn how to form words and speak clearly. Reason number three, they can affect permanent teeth. A severe infection or a pus formation in a baby tooth can actually travel down and damage developing adult tooth underneath it. So, when should we start caring for them? The answer is before they even appear in the mouth. Even for newborns, we recommend that you wipe off their gums by using a soft baby tissue cloth just to clean the gums so that there is no feeding bacteria over them. The first dental visit. Pediatric dentistry recommends that a child goes to the dentist by their first birthday or within 6 months of their first tooth erupted in the oral cavity. Now I know what you are thinking. What is a 1 year old going to go to a dentist and be there on a dental chair? This first visit isn't about x rays or cleaning their teeth, it's about building comfort and familiarity. We call it a happy visit. What do we do? Knee to knee exam. We make the parent and the child sit on the dental chair and cradle the child in hand so that the dentist checks. Then, checking development, normal jaw growth, clean teeth with soft brush, apply fluoride varnish if necessary. Then, parents' question and answers, the diet, the nighttime feeding bottles, the pacifier uses, and about mm, commonly is lip biting or nail biting, or using their thumb as a pacifier in their mouth. These are the common questions that we are often asked. Starting early prevents dental anxiety for the child as well as the parent. Age by age guide of brushing and flossing. As your child grows, their oral hygiene routine needs to grow with them. Age 0 to 2. As soon as the teeth appear in the oral cavity, brush twice daily. Use a tiny smear of toothpaste like a grain size. Age 3 to 6. A pea sized amount of a toothpaste. Teach them to spit bubbles rather than swallowing them. You still need to do the actual brushing here. Kids don't develop manual dexterity to brush effectively on their own. Age 7 and above, they can take over brushing, but you should still supervise, and brushing should be done for 2 minutes, and that too twice a day. And don't forget flossing. The rule of the thumb is simple. As soon as two teeth touch each other, it's time to start flossing between them. Bacteria loves hiding in between those tight places where tooth bristles don't reach. The truth about sugar, diet, and cavities. Let's talk about food. We all know candy causes cavities, but there are some hidden dental villains lurking in the pantry right now that might surprise you. Sticky foods like gummy vitamins, fruit snacks, dried fruits are incredibly tough on teeth and they glue onto the grooves of the tooth, making them a perfect predation for all these bacteria to hunt down the teeth and cause cavities, and if left untreated can further lead to a lot of dental issues and pain and inflammation on the baby. It is not just about what your child eats on a daily basis. It's even the sugars and the carbs that need to be counted. How to break the habit? Focus on positive reinforcement. Preventive treatments are sealants and fluorides. The fluoride varnish. We paint this concentrated mineral onto the baby teeth. It acts like a shield, remineralizing the weak spots on the enamel, making the tooth more resistant. Second is the sealants. The chewing surfaces on molars have deep pits and grooves where bacteria love to stay on. A sealant is a thin protective plastic coating that protects these grooves. Setting up your child for a dental success isn't about being a perfect parent. It's about building small, consistent habits, making them brush twice a day, and starting them to floss between two teeth is a regular thing, and limiting their snacking and going for a regular 6 months checkup. If you find this video valuable, do like and share to the channel. And thanks for watching.